I have a patient who I wanted to start on an antihypertensive medicine in order to decrease her risk of stroke, but she adamantly refused to take it. I believed, if only I could find the right way to state it, I could change her mind. When I was young, I loved dinner conversations with my dad about cancer. He showed me pictures of tumors and would talk about effective drug delivery and how the medications could prolong patients' lives. The way he would explain it was so beautiful, simple, and hopeful. When I was in high school, I loved going to his lab and looking at mice who had cranial windows where you could actually see their brain tumors. But I wanted to know more. What was it like to have a tumor? What was the impact on real people? So I went to university and studied psychology. Reading articles and doing research, I found that the evidence was never so clear. There were always multiple factors and reasons why people were depressed and anxious, and there was never one simple treatment or even multiple treatments that would work for someone. There were so many variables. It was frustrating that I could never have a clear answer. One day, I was speaking to my friend's father. He told me he was an engineer, but had always wanted to be a doctor. He liked the mathematical side and the simple solutions, but also enjoyed the human complexity. I realized that being a family physician was a way I could combine both. I asked the psychiatrist to help me convince my patient to take her medications, but it didn't work. She wouldn't change her mind. After our meeting, the psychiatrist asked me why it was so important for me to follow the medical guidelines. That seemed like such an odd question, because to me the answer was obvious. There is scientific evidence to prove that antihypertensives reduce your risk of stroke. But then I thought, maybe it's not so obvious. Humans are not mice. She has multiple medical conditions. She's had bad side effects already. She's seen someone pass away from a stroke, even though they had been on the right medications. And I need to keep those things in mind when I think about her care. I realized I had swung too far to the simple, elegant solution and away from the human complexity and the necessity of finding that balance between the two in my practice.